Thorpe Road surgery is a long-established surgery. We've been here at its current location since 1994, and we're committed to preserve and enhance its good reputation for being caring and by providing high-quality care to our patients in a friendly, happy and a healthy environment. At Thorpe Road Surgery, we focus on improving all aspects of individuals' healthcare needs, and we ensure patients are informed and involved with the decision making about their healthcare. We are a friendly team of 14 members. We have 4 GPs, 1 nurse practitioner, 2 nurses, 4 receptionists, and not forget our practice manager. We have a good skill mix at Thorpe Road Surgery to meet the health needs of our local population. We have developed specialist interests amongst ourselves. For myself personally, I have a special interest in diabetes, and my colleagues have special interest in dermatology, for example. And we also, amongst ourselves, we speak a different variety of languages, which also goes in some way in helping us looking after our patients at Thorpe Road.
I'm not a GP with a special interest, but I do love my contraception and women's health in general, I must say. So yes, it's a bit exciting when I get women. Yes, it's not exciting for the woman who comes in with those problems, but it gives me that buzz to be able to deal with issues relating to women's health, really. There are 2 female doctors here, so it helps for women to come and see either one of us. So I'd say that's great.
I did have a specialty in dermatology. I used to have quite an interest in skin medicine, and I used to work at the hospital at one time, just 1 session a week, which was really interesting and quite relevant to what we do, because we see quite a lot of skin disease but don't necessarily know what to do about it. So yeah, I've got quite an interest in skin disease, although I don't practice anymore at the hospital. And then I think, we all have our sort of little areas that we quite like, are interested in. But overall, I think that's the whole point. You don't really need to specialise very much. You can see a bit of everything in one day's clinic, which is good.
My role here is to mainly do things like dressings, asthma reviews. I do baby IMS clinics, wound care, BP monitoring. That includes 24-hour blood pressure, ECGs, as well as 24-hour ECGs. Quite a broad range of treatment room services we provide, plus the extra added chronic illnesses.
We've currently got 6,000 patients on our registers, and we continue to grow, and we are getting an increasing number of ethnic minorities, people from ethnic minorities joining our surgery.
Quite a mix of patients. We see from newborn babies right through to 102, I think our oldest patient is, so quite a diverse range.
I mean, the practice has grown a lot, both in population, and it's sort of grown in size in terms of how many members of staff we have, number of doctors, that kind of thing. So inevitably you get a bit of a shift away from knowing every single patient. At one point you sort of know most people that you see by face, at least, if not by name. And that becomes less and less possible, I think, as the practice grows. But that's not necessarily a bad thing. And I think the beauty is that as we've grown, we've got more doctors, so there's a bit more variety for patients. If they do need to see a female GP, now we've got 2 doctors that they can choose from. There's a lot more accessibility. So things have changed in terms of expansion, but not in a bad way, I'd say. It sort of worked out quite nicely, I think, for patients especially.
Over the last few months, we are expanding, we're getting more patients, so it's becoming increasingly busy.
we worked hard in last quarter year, and we achieved 95% of the points. We did lose we lost some points on the diabetes indicators, and we recognise this being a challenge for us, and we are taking note of this and making some changes really to make sure we reach out to this group of people, group of patients. So to help us do this, well, I have actually, like I said, mentioned earlier, I have got a special interest in diabetes, and I have actually got a diploma and postgraduate diploma in diabetes. I've also led some presentations to our patient groups at the surgery, and we hope we will continue to do this in the forthcoming months and years. Over the past year, we actually have a very active patient participation group, and they helped us in organising these evenings where patients are invited, sent open invitations really to attend informative sessions with the clinician. And it has been me on these previous occasions where we try to educate patients. And with regards to the diabetes presentation we had, it was just to raise awareness of the importance of achieving good glycemic control to prevent complications. And this has been successful to a certain extent, but we would hope that in the future we had a much bigger participation from our patients. And we will continue to work with this group of people. We recognise that this is something that is not going to go away, and we do need to keep working at it. For the over 75s at Thorpe surgery, we maintain a register, and we discuss this at monthly meetings where obviously the healthcare needs and the social care needs are assessed, and they are often passed on to the MDT, where we work closely with the social services, mental health care workers, and also some representatives from the Age Concern, Age UK, and just to make sure these people are being looked after. And we offer regular home visits to these patients. And I actually have some patients who I visit on a regular basis. We have a named GP for all these patients who coordinates their care. We also have a care MDT coordinator who actually discusses these patients at the MDTs locally. We offer these patients longer appointments when they attend. We encourage uptake of flu vaccines during the winter. Talking about patients with long-term conditions, we have nurse-led clinics, under the close supervision of the doctor. Again, these patients also are encouraged to take up the flu vaccines, and the pneumonia jabs, the shingles vaccinations. We at Thorpe surgery, the nurse leads the childhood immunization clinics. We offer women's smears, contraceptive advice, again for the children we offer appointments outside school hours. We have a safeguarding lead, and we meet regularly with our health visitors. So for the working age group of patients, we offer extended hours. We offer them online prescriptions, and they're also able to book their appointments online if needed. We use SMS reminders. We are working together as a group of 10 practices, looking after 80,000 patients across Peterborough. And the aim is to provide 8 to 8 care during the weekdays, and also on the weekends as part of the Prime Minister's Challenge Fund, improving access to GP services throughout the week. Again, to further enhance access to the GP services to this group, especially to this group of patients, we have signed up for Web GP, which is an online consulting option, and also we're in considering taking up consultations on Skype, over Skype, and this is something that we're working on as we speak. People with learning disabilities, we invite them to the surgery on an annual basis. We offer them longer appointments. We also encourage them not only to access GP services, but also, for example, dental services and other community services, attending day centres and things, etc. We are actually quite good at recalling these people as a practice. We've been having students from Cambridge University for the past 4 years. It is an enjoyable experience for all of us, and it does actually prompt us to keep up to date. It can be challenging at times, but we all enjoy it. They're here in blocks of 2 weeks, 4 times a year. And we've just had our last set of students for this year.
It's been really positive. All the doctors are really nice, the receptionists are really helpful, and I think we get a really good mixture of clinical exposure combined with kind of self-directed study time.
So far experience has been really good, very positive. The doctors here are very friendly and very keen to teach. It's a small practice, so there are only a few of us compared to other practices where there are more students, but in a way that's good because we get good hand-to-hand teaching. And Dr. Shah is very attentive, he keeps checking whether or not we are really doing, whether we really have enough to do and all that. Yeah.
Thorpe is really good because they have a very varied patient cohort, so it's quite different to patients you would see elsewhere, because they have a lot of ethnic minorities and patients with learning difficulties, as well as maybe patients who are deaf and have special needs. So you kind of get to experience a wider range of interactions with patients than you would otherwise.
It's quite a small practice. They do care very much about their patients and also very much about the teaching quality here. So especially Dr. Shah, they really go above and beyond what's required and really try to accommodate us as far as possible. So one example, I suppose, would be when bringing us out to see patients, he'll drive us out personally and just hanging around outside and checking on us every often. Is everything going all right? Is the patient going all right? Anything more that they can be doing for you? So I think in that sense it's really reassuring that there's that level of, that they're paying attention to us, right, that we're not being left to our own devices completely.
We have a very good team at Thorpe Surgery. Our receptionists are very observant, especially from the waiting room, if they take anything that is not right and report it to the safeguarding lead, which is myself. But we all work hard, but they actually maintain a good atmosphere during the day. You know, we work in a very friendly environment and they play a big part in doing that. We enjoy very positive comments from the patients, and they're really good at what they do. The current building is a Victorian, is a form of Victorian 4-bedded house, and obviously the old part of the building is on 2 floors. It was in 1994 when it was converted to a surgery, and where we had a purpose-built extension to the rear of the building. in our efforts to obviously to absorb the growth and absorb and to expand the practice, we've had to leave the frontage of the building unaltered. The front elevation of the building, we can't really make any changes to it, as it all happens to be a building of local importance, which obviously has its restrictions on it, albeit it is a lovely building. And we get comments from patients and passers-by all the time. We also have a big parking space for our patients, which is an advantage nowadays, and also which also obviously improves access to our patients, and they can actually park right next to the building, and offering even easier access to people with disabilities. In the future at Thorpe Surgery, we are growing quite fast at a rate of about 10% a year. And we are being stressed in a way that we do not have enough rooms to provide the service. Although we have some clinical capacity, there isn't enough room for us to absorb the increase in these sizes. We've been fortunate over the past few months where we've actually we've been able to apply for the Prime Minister's Infrastructure Improvement Grant, where we've been successful, and as we speak, we are waiting for our plans to be approved, and hopefully in the next 6 months we aim to have 3 extra clinical rooms, an extended waiting area, and hopefully that will give us the capacity to absorb the expansion of housing that we have around us in this area here. So it is challenging, it is hard, but I think we've recognized and hope when we will be ready to provide the service that we do at the moment. The expansion will see us in good shape to meet the needs of the growing population at our practice as we look to the future.